Like, what does it look like day to day living, being on a clinical trial from someone who runs many and involved often with rare tumors where the trials are, very few patients on a trial? Sort of, what does that look like day to day or week by week?
Yeah, I agree with you completely, Jason, that I think it really depends on the phase of the clinical trial. And there was a question about phases of clinical trials, which maybe I could just go through briefly. But for a phase 1 clinical trial, where our goal is to find the dose that's right for the medicine in children, it does definitely involve more visits than you might be used to as part of upfront therapy, and more visits than would be required for standard of care, or longer visits than would be required for standard of care. Because as you mentioned, we often have to check the level of the drugs in the blood, and we need to do other tests to look for side effects of the medication. And so often for that first month of therapy, you would be coming at least weekly to see your doctor, and sometimes may need to stay in the area for up to that first month of therapy, depending on the trial. After the first month, the sort of required level of observation backs down to some extent, because we now have some understanding of how your child is tolerating, is doing with the medicine. So it backs down, but it's still more involved. Whereas, as you mentioned, for other, phase 3, which are the sort of large children's oncology group studies for all newly diagnosed patients, those clinical trials generally look very similar to standard of care, with, as you mentioned, sort of small tweaks to the treatment schema, but a similar amount of visits and other things that you would experience.